Tantor Audio, a division of Recorded Books, presents Pain Erasers, the complete natural medicine guide to safe, drug-free relief by Michelle Schoffro Cook, Ph.D., DNM. Narrated by Nan Mcnamara. Part 1. New Hope for Pain Sufferers. Introduction. I know pain. I know the aching, throbbing, arthritic kind. I'm familiar with the bruised and burning, torn muscles variety. I know the shooting, knifing, excruciating pain of migraines, nerve damage, and body injuries. Whatever pain's expression, I'm familiar with its work. I suffered a severe car accident that left me with a partially severed spinal cord. The emergency room physician told me I was this close to being quadriplegic. As if that was not enough, I later experienced the unbearable agony of a broken back. I felt constant and severe pain for many years. It nearly destroyed my life. My pain was so debilitating that I found it almost impossible to work, perform normal day-to-day functions, or have much of a life. I tried everything to which I was introduced, but nothing worked well or lasted long. Pain medications should have been a welcome respite, but even prescription narcotics offered no noticeable relief. And since they were highly addictive and replete with terrible side effects, I stopped using them within a week of receiving the prescription more than 20 years ago. On one particular occasion, I had stayed indoors, alone in the darkness of my bedroom, away from all light and noise, suffering with a migraine for nearly a week. This was a common occurrence and had been a significant part of my life for the past several years. On this day, like many others, I was desperate for the pain to end and feeling despondent that it never would be over. Eventually, I balanced my desire to race toward a solution with my need to step gingerly to avoid exacerbating the pain and headed downstairs. I wanted to look up possible emergency services. It was nearly 6 o'clock on a Saturday evening. My husband exclaimed, "Nothing will be open." Tears running down my eyes, I knew he was right. But I needed help. I found an emergency hotline answered by a compassionate doctor who, after asking me a series of questions, advised me to come straight to his clinic. This doctor of chiropractic spent 2 hours running tests and x-rays, conducting manual mobility and spinal cord assessments, and showing me the various problems in my spinal cord, nerves, and more, which were contributing to my pain. The doctor didn't stop there. He explained various natural remedies, treatments, and exercises I could do to alleviate the pain. And he asked my husband if he would be willing to assist, which of course he was. So Dr. Robert LeCaire, this compassionate doctor whom I am fortunate to now call a dear friend, taught my husband additional ways to help me relieve pain. I left Dr. Rob's clinic feeling lighter, with a significant reduction in pain and a sense of freedom I hadn't known in years. I could barely hold myself together as we went back to the car. The moment I sat down, I began sobbing, this time with tears of joy. I was overwhelmed with relief that the pain had finally dissipated. Perhaps even greater than my pleasure over the elimination of the pain was the empowerment I felt because I finally had some solutions to help me deal with the pain whenever it might return, which, given the severity of the causes of my pain, it did indeed. But for the first time, I had some effective pain management options, and now that I had periods without pain or with much less pain, I was able to look deeper into the remedies Dr. Rob suggested. As I continuously improved, I was able to spend more time trying to discover other natural remedies that might help me. Motivated by my progress and hoping to permanently end the excruciating pain that had become my life for so many years, I spent hours and hours reading up on proven natural painkillers. Before meeting Dr. Rob and starting my research, I believed that nothing in nature could be as potent as drugs. But my desperation forced me to give natural options a fair chance. And my experiences and research proved me wrong. I discovered that many of the most powerful anti-pain remedies are found in nature in the form of herbs, essential oils, and nutrients. The problem with most natural options, however, is that they rarely come with adequate instructions on their effective use. I don't think the manufacturers intend to leave people in the dark on the best ways to use their products, but most producers of natural medicines are limited in the claims or guidance they can give customers due to legal restrictions placed upon them by regulatory authorities. I began using my body as a laboratory, experimenting with a wide variety of natural options, varied doses, and an assortment of regimens. After countless hours, months, and even years of experimentation, I found the best natural medicines to alleviate the pain that plagued me. I still get pain when I overdo certain things that aggravate the spinal cord nerve endings or the area where I broke my back, but I am now armed with knowledge and natural remedies to mitigate the pain that once ruled my life. I also have a rewarding career as an author and manage a stunning Victorian-era orchard on my acreage. Although my time was once spent in agony and darkness, my life is now filled with joy and light. I am happy to share with you the culmination of my more than 25 years of research, personal experimentation, and clinical experience in this book. Pain Erasers, the complete natural medicine guide to safe, drug-free relief, showcases the proven natural pain erasers backed by science and personal experience rather than theory, ad copy, or complex bodywork regimes. It is my hope and belief that the information contained here, along with the correct use of the remedies I share, will transform your life as it has mine. In Pain Erasers, you'll find simple ways to free your life from pain and determine which remedies will work best for you. You'll learn the best essential oils, herbs, nutrients, and other natural remedies for joint pain, nerve pain, soft tissue pain, muscle pain, headaches, migraines, arthritis, fibromyalgia, neuralgia, and many other types of pain disorders. You'll discover the exciting research that shows just how effective these natural painkillers can be. You'll learn the best way to take each remedy to yield results. No medicine works if it is not properly taken, yet that is exactly what most people do when it comes to natural remedies. They take them in the incorrect form, at an insufficient dosage, and too infrequently to yield results. I will teach you how to maximize each remedy's healing properties and share my pain protocols that get great results. I should know. They've worked for me and the thousands of patients I've worked with over the years. If you are among the nearly 70 million Americans who suffer from chronic pain, an estimated 50 million suffer from chronic pain, and an additional 20 million suffer from high-impact chronic pain that severely restricts their lives, I am confident that you'll find improvement or relief in this book. Considering that many of these people also suffer from addictions to painkillers, the research on these natural options could not be more timely. Let's face it, few people have the time to sift through the studies or follow complex bodywork programs and arduous therapies, particularly when they are suffering. While these programs and therapies may have merit, they are beyond the capacity of many people. With Pain Erasers, you will be privy to proven pain-busting natural remedies from which you can immediately and effectively benefit. Something tells me you are already an expert on pain and how horrible it feels, and that you simply want trustworthy guidance toward relief. While I discuss pain briefly in the first chapter, what you don't know about pain may be hurting you, I have kept it short because the last thing you likely want to hear about when you're suffering is the theory behind pain. Instead, we're jumping right into exploring the types of pain you may be experiencing to better help you pinpoint the best remedy to help you find relief. In Chapter 2, Erase the 20 Most Common Pain Conditions, you'll discover 20 of the most common pain conditions and what's happening in the body in each of these conditions, along with my natural pain prescription outlining the best remedies for each pain disorder. These conditions include back pain, carpal tunnel syndrome, diabetic neuropathy, eye pain, such as macular degeneration and glaucoma, fibromyalgia, migraines and headaches, plantar fasciitis, PMS and menstrual cramps, TMJ syndrome, tendinitis, trigeminal neuralgia, and whiplash. In Chapter 3, Heal Your Gut, Heal Your Pain, You'll learn about the exciting and cutting-edge research on the importance of a healthy gut in alleviating chronic pain. A healthy, microbially balanced gut is perhaps the most overlooked factor in treating or managing pain. Yet, surprisingly, I haven't seen it discussed in any other pain book. You'll learn the best remedies to heal your gut to set the foundation for great health and a pain-free body for life. In chapters 4 through 24, you'll discover many of the best natural painkillers available and how to use them for optimal results. If you're like most people, you may have tried some of these remedies, but may not have used them correctly, not through any fault of your own, but because this type of information is largely unavailable. It's not listed on product labels and is rarely mentioned in books or other publications. You'll find the research behind the remedies, from birch essential oil to willow bark. You'll learn about a powerful remedy from the Amazon rainforest that you may not have heard about. You'll also learn about the pros and cons of cannabis to help you decide whether it makes sense for you. In Chapter 25, you'll find many other supporting remedies that help alleviate pain and inflammation. While they are not the stars of the pain-erasing show, they play important supporting roles to help you get the best results possible. These remedies include astaxanthin, comfrey oil or ointment, glucosamine sulfate, methylsulfonylmethane, MSM, and others. In Chapter 26, The Pain-Erasing Diet and Lifestyle, you'll learn the fundamental information to help you maximize the results you get from the remedies that follow in this book. You don't want to unknowingly thwart your best efforts and the best effects of the natural remedies presented by eating foods that worsen pain. In this chapter, you'll also discover research-based information about foods that help alleviate pain when eaten on a regular basis, along with advice about the importance of gentle exercise and emotional healing, since movement and the healthy release of pent-up emotions can improve pain. It is my hope that this book will give you the sense of hope that Dr. Rob first gave me and that later I gleaned from my research and experimentation with essential oils, herbs, and other natural medicines. I encourage you to try the remedies I've suggested throughout this book and to stick with them to get the results I know you can have. I hope that this book helps give you the quality of life free from pain that you so truly deserve. 1. What you don't know about pain may be hurting you. We've all experienced pain at some point in our lives, and sadly, most of us have experienced it on many occasions. From the first time we trip and fall while learning how to walk, to occasions when we suffer much more serious injuries, accidents, illnesses, or other types of pain. The unfortunate reality is that we encounter different types and severities of pain during our lifetime. If we're fortunate, we feel only mild or short-term pain, known as acute pain. But for many people, pain can become chronic, often destroying their quality of life and ability to perform daily tasks. For some people, pain can be excruciating, completely disabling them and causing severe emotional distress. While people often deal with pain by popping an over-the-counter drug or applying a cream to the affected area, frequently these options don't work or work only minimally. Because pain is different for every person and has a wide range of expressions and descriptions, it can be difficult to treat. Worse than that, many pain drugs have serious health-damaging side effects that can be undesirable. Some drugs can cause organ damage and can even be lethal. While pain is a part of life, knowing what causes the pain we're experiencing, or better yet, how to deal with it in the least invasive and most effective way, is a set of skills we can all use. And I think most people would agree that knowing how to deal with pain in a way that is harmonious to the body and free of serious or life-threatening side effects is priceless. Pain is not your enemy. Pain is usually a symptom of underlying issues in the body, and while it doesn't feel like your friend, it is not the enemy most people think it is. Pain may actually be a messenger to draw your brain's attention toward an area of your body that needs attention and healing. Unpleasant at best and excruciating at worst, pain is a physical experience that indicates tissue damage, It's the body's attempt to prevent further damage and to heal the existing tissue damage. We experience pain when a signal travels via nerves to the brain, where it is interpreted. For example, if we put our hand on a hot surface, the body sends a message through the nerves in the hand that travels up the arm, through the spinal cord, and to the brain, where the brain identifies the sensation and sends a signal back to the muscles in the hand to pull the hand away from the hot surface. The brain also sends a signal back to the hand, registering the burning sensation, so the brain can rally its resources to help heal the burn. These signals happen at a lightning-fast rate, so we barely notice a moment between them. The good news about this communication system and how quickly it works is that it can be manipulated to interrupt these pain signals so we can significantly reduce or halt our pain altogether. We can use natural remedies that affect the brain and its hormonal messengers to reduce inflation, improve tissue healing, and ultimately alleviate pain. What causes pain? There are many different causes of pain, but the most common ones are linked to bone or joint damage that occurs through wear and tear, as well as to nerve damage and injuries that haven't healed properly or fully. And, of course, there are many other varieties that involve tendons, ligaments, or the circulatory system. While some pain is linked to a single cause, more often it has multiple causal factors. For example, back pain can be caused by poor posture, degenerative changes to the spine, incorrect lifting or carrying of heavy objects, being overweight, since additional weight adds extra pressure to the joints and bones, incorrect curvature of the spine, an injury from a sport, car accident, or other trauma, sleeping on a poor mattress or with insufficient pillow support for your neck, wearing high heels, experiencing severe or chronic stress, or some other lesser-known or unknown cause. Of course, there are many underlying health conditions that can also cause pain, including cancer, fibromyalgia, gallbladder disease, human immunodeficiency virus, HIV, multiple sclerosis, osteoarthritis or rheumatoid arthritis, and ulcers. The source of pain may be obvious in some cases, but in others it can be quite enigmatic, leading doctors on a journey of medical discovery as they attempt to find the mysterious root cause. For many people, such a process and the lack of knowledge about the cause of the pain can be highly stressful, as the chronic pain condition continues to cause suffering. Uncertainty about the cause of the pain can make it difficult to effectively treat. It's equally important to understand that the inflammation you experience is the body's way of coping with an injury, trauma, or infection, or addressing a damaged area that needs healing. It means that your body is sending out white blood cells to the problem spot to fight infection, oxygenated blood to repair damage, and other fluids to cushion damaged cells in an effort to protect the area from further damage. While this process is normal and indeed healthy, when it continues for a lengthy period of time, or when it continues throughout the body at a low-grade level, it can become a problem. Any damaged areas can become vulnerable to further damage over time, or may not properly heal, and you may be left with ongoing chronic pain. It may surprise you to learn that in many cases your gut health, or lack thereof, may be playing a role in causing or aggravating inflammation throughout your body or in isolated places that seem unrelated to the gut. Yet a growing body of scientific research shows that the traditional treatments for pain may have overlooked or even worsened a causal factor for pain, the microbial balance in the gut. See Chapter 3, Heal Your Gut, Heal Your Pain, for more information about the gut inflammation connection and to learn how you can restore great gut health naturally. Of course, whether or not you know the cause of your pain or inflammation, have been diagnosed with a pain disorder, or are still undergoing diagnostic tests to determine the cause of your pain, I encourage you to try the remedies suggested throughout Pain Erasers. Reasons to skip high heels. If you're opting for sky-high stilettos or even mid-level pumps, you could unknowingly be harming your health and aggravating pain. That's because, according to Ottawa chiropractor and pain expert Dr. Robert LeCaire, as well as scientific research, High heels may be the root cause of many different health conditions, including fatigue. Heels over 2 inches can increase lower extremity muscular stress that constricts blood vessels and limits blood supply to muscles and the brain, causing a reduced flow of oxygen and a general sense of fatigue. Knee pain. According to a Harvard study published in The Lancet, wearing heels around 2.7 inches or higher is linked to a 24% increase in knee strain and pain. Bunions. Bunions are deformations that tend to occur at the base of the big toe, causing the normally straight toe to become directed toward the smaller toes. High heels force the weight of the body onto the front of the foot, creating an increased pressure on the base of the big toe, which can make people more vulnerable to bunions. Bunions cause swelling, stress, redness, and pain. Foot pain. In addition to bunions, Dr. LeCaire says that high heels are linked to numerous other foot problems, including metatarsalgia, pain in the ball of the foot, and Morton's neuroma, a thickening of the tissue around a nerve between the third and fourth toes. Low back pain. High heels force you to walk with the pelvis arched forward, causing hyperlordosis, a backward bend of the lumbar spine, says Dr. LeCaire. This unnatural spinal curvature places excessive stress and strain on the lower back, which may result in lower back pain. Nerve irritation. The unnatural curvature of the spine caused by high heels increases the pressure in the lower spine and can cause nerve irritation and reduce healthy nerve communication with the many organs and tissues these nerves feed. Since these nerves support the proper functioning of many organs and tissues, improper nerve communication or irritation can affect their ability to function in a healthy way. Ankle pain. Wearing heels over 2 inches can create faulty biomechanics and place needless stress on your ankles, causing ankle pain or other ankle problems. Hip pain. The same is true of the hips. High heels cause a forward pelvic tilt that can result in hip pain and strain. Spinal problems. The unnatural curvature caused by wearing high heels can place a tremendous amount of stress on the spine, resulting in pain or spinal problems. Types of pain. There are many types of pain. Pain can be acute, short-term, or chronic, long-term. It can be local, in one part of the body, or widespread in multiple places in the body. Pain is often described by the bodily part that is involved, such as joint, muscle, nerve, tendon, ligament, or bone, but it can also be described in terms of the condition underlying it, which can include arthritis, cancer, multiple sclerosis, and so on. Additionally, doctors usually classify pain by its level of origin. On the surface, or just below the surface of the skin, somatic pain; from within the organs or cavities of the body, visceral pain; or perceived elsewhere in the body than the site of the origin, such as pain down the arm caused by a heart attack, referred pain. It is helpful, whenever possible, to know the type of pain you're experiencing, acute or chronic, localized or widespread, and to know which body parts or organs are involved. This way you can select the best pain remedies to yield the greatest results, rather than just pop them in an ad hoc manner, which tends to produce poor results. Before we explore the natural options, let's explore some of the problems with commonly used pain drugs. The problems with pain drugs. Move over Advil and Tylenol. Step aside Aleve and OxyContin. If you take pain relief drugs, you may want to consider the effects of doing so. Prescription drugs are the third leading cause of death in the United States and Europe. The pharmaceuticals that millions of people turn to for relief from pain, inflammation, and other symptoms are not only causing side effects, but actually damaging the health of many people. Simple non-steroidal anti-inflammatory drugs, NSAIDs, are linked to a lengthy list of side effects, including bleeding gums, blood in the urine or stools, difficulty breathing, difficulty swallowing, dizziness, headaches, lightheadedness, and liver failure. Similarly, over-the-counter drugs that pain sufferers often pop like candy result in 30% of hospital admissions for adverse drug reactions, primarily due to bleeding, heart attack, stroke, and kidney damage. Sadly, for many people the problem is even worse than that. Every year, the side effects of long-term NSAID use cause 103,000 hospitalizations and 16,500 deaths. Yet countless pain sufferers rely on these potentially life-threatening drugs to get through their days. Prescription and over-the-counter medications also deplete your body of the vitamins and minerals required for basic functions. Over-the-counter pain relievers like aspirin, Advil, Aleve, Tylenol, and others on the market decrease your body's vitamin C, folic acid, vitamin B9, iron, and zinc. Steroid drugs like prednisone, hydrocortisone, dexamethasone, beclomethasone, and triamcinolone are known to deplete pyridoxine, vitamin B6, vitamin C, vitamin D, vitamin K, potassium, and zinc. While that might not seem like a big deal, these deficiencies can worsen pain disorders by denying the body the building blocks it needs for tissue repair, which can indirectly affect pain. Additionally, these nutrients are needed to keep your immune system strong, maintain cellular integrity, build healthy blood and bones, heal wounds, and nourish joints, tendons, ligaments, and muscles. Without sufficient amounts of even a single nutrient, your body may struggle to heal injured areas, and you may experience greater pain as a result. Stronger prescription drugs, like opioids, which are usually prescribed for the most severe acute pain linked with major bone breaks or fractures, burns, cancer, and surgery, are often associated with addiction and an extensive list of side effects. Some side effects of opioids are cognitive changes, constipation, delirium, itchy skin, nausea, and sedation. You may have heard of some types of opioid drugs, including codeine, fentanyl, hydrocodone, methadone, morphine, oxycodone, and naloxone. When used incorrectly, in excess, or in street versions, they can be fatal. Additionally, opioids, which are also sometimes called narcotics, can be dangerous when used in combination with alcohol, some antidepressants, some antibiotics, and sleeping pills. Opioid use can also affect the progression of other health conditions, including chronic obstructive pulmonary disease, COPD, dementia, kidney disease, liver disease, and previous drug use disorder. Harsh prescription pain drugs can often leave people with worse health issues than those they intended to treat. Due to the addictive nature and potentially severe side effects of these drugs, most people find them undesirable. While we could discuss the dangers of drugs indefinitely, and indeed there are many resources on this topic that I encourage you to read, this is not a book about drugs. It's a book about natural, safer options you can use in the treatment of your pain conditions. Stress and the emotional effects of pain. Stress can take its toll on any aspect of our health, so it will probably come as no surprise that stress often aggravates pain conditions. In an article published by the Arthritis Foundation titled The Emotion-Pain Connection, David Buxton, MD, shares his view that chronic pain and emotions are so intertwined that it's often hard to tell where one ends and the other begins. Buxton states that people with depression, for example, have about 3 times the risk of those without it of developing pain. Conversely, he adds, those with chronic pain have about the same increase in risk for winding up with clinical depression. For those suffering from pain or depression, the situation can feel like a vicious cycle that is hard to break. It is important to remind yourself during these times that your view may be clouded by pain and that there are natural remedies and strategies that can help you cope with both the stress and pain. It can feel like there isn't much that can be done about stress other than removing the source of the stress in our lives. However, there are actually many dietary and lifestyle strategies, as well as natural remedies that can help our bodies cope with the effects of stress or reduce the amount of stress we're experiencing. You'll find lots of these strategies and remedies presented in Chapter 26. Pain erasers can help. Whether you're suffering from acute or chronic pain, bone, joint, or nerve pain, or any other type of pain, the natural remedies presented throughout pain erasers can help. Of course, you should consult with your physician before changing or discontinuing your medication, adding new remedies, or altering your dietary, remedy, or exercise regimes. While Pain Erasers is meant to assist you in pain management, it is not intended as an alternative to a qualified health professional.
Sample complete. Ready to continue?